your NCLEX, stop scrolling, pay attention to the end, make sure that you like, save, share, comment this out to help a nursing buddy. Let's go over Bowtie questions. These questions on the NCLEX look really scary, right? But I promise they're really just like critical thinking in a cute little shape of a bow tie. Bowtie question gives you a patient scenario in the middle. Then it asks you to choose 2 actions you'll take, 1 parameter to monitor, 2 potential complications. That's why it looks like a little bow tie. Middle is the problem. Sides are your decisions. I want you to start by asking yourself, what's actually wrong with my patient? That's where patho comes in. Example would be, a patient with DKA has fruity breath, small respirations, glucose of 480, and dry mucous membranes. Patho is there's an insulin deficiency, so there's fat breaking down, fruity breath, got ketones, and acidosis, and they're dehydrated. The core problem is going to be metabolic acidosis plus dehydration. The next step would be, you're gonna pick 2 most immediate nursing action, correct or stabilize that patho. DKA, you're gonna start IV fluids to fix the dehydration. You're going to administer regular insulin to stop the fat breakdown and lower the glucose. Always treat the cause and the consequence. In DKA, the cause was there's no insulin, and the consequence is there's dehydration. You have to fix both. The next step would be what to monitor. What would tell you that the patient is getting better or worse? What would you monitor? Serum potassium. Why? When insulin pushes glucose into the cell, potassium follows it. That's why they get hypokalemia. You're gonna watch your labs and you're gonna watch your ECG for that low potassium sign. If you have simply NCLEX, know what that cardiac strip looks like. I go over that into greater detail. There's telemetry all in there. Guarantee you the NCLEX will test you on what potassium does to the heart. You'll know that inside and out once you finish my course. How you know you're monitoring your serum potassium? Now, you have to choose the 2 complications you can have. That would be like, what bad things can happen if this isn't fixed? DKA complications are going to be your hypokalemia, which is from insulin and the fluid to have cerebral edema. The glucose drops too fast. NCLEX tip would be, think, if I do this intervention, what could go wrong next? That's how you will find out if you have the right complication. Answer. Another example would be heart failure. In the middle, your patient has CHF. They got crackles, dyspnea, edema, O2 sats of 88%. What are your actions gonna be? You're gonna give oxygen. You're gonna administer IV furosemide. What are you gonna monitor? Eyes and nose, especially output. What are your complications if you don't fix CHF? Pulmonary edema, hypokalemia from the diuretics. We know if you have CHF, the heart is pumping very weak. So that is decreased perfusion, which is decreased perfusion to all of the tissues of the organ. If you fix the oxygen problem and you fix the diuretic part of it, then you can watch the kidneys and the electrolytes. I hope this makes it just a little bit more simpler for you to understand. Bow ties don't have to be confusing. Just make sure that you know the problem, know what you're monitoring, and you know what the complications can be if you don't fix the problem. They are tricky and they are meant to be, because they're testing you on, can you connect the patho to the priority care? Find the problem, fix it, monitor safety, and predict what could go wrong. That is how you should attack every single NCLEX question. But they want you to know, they want you to critically think like a nurse, prevent complications, monitor safely, predict what is going wrong so your interventions can stop things from getting worse. I go over this in great detail in Simply NCLEX. Do not have it. I highly suggest go getting it if you're serious about passing your NCLEX. At the top of my page all the time. It's on sale this week. I hope this helps. Like, save, share this out, comment down below. Happy studying.